This conference will now be recorded.
Can you unmute, please?
Welcome to our third webinar in our new monthly webinar series. My name is Brenda. I'm the Administrative Assistant at FitLogic Functional Medicine. I will introduce our speakers in just a minute. Before I do, I want to let you know that we're recording this webinar and we'll share it to your email in the next week. It will also be posted on our website under Resources with our previous webinar recordings. This month, we're taking testosterone for women, which is extremely safe, effective, and beneficial, but just gets swept under the rug, leaving women feeling hopeless. The good news is we have experts who have taken the time to learn and know what science says, rather than just follow big pharma and ignore the evidence. After today's webinar, you'll be armed with information to advocate for yourself. You will understand what makes sense. And guess what? It's not the standard. We challenge you to open your mind and think outside the box with us. Our treatments are 100% evidence-based and not driven by political or economic bias. Our first speaker is Megan Miller, owner and founder of FitLogic Functional Medicine, nurse practitioner and hormone expert. Megan has extensive postgraduate training in preventative and functional medicine and is certified in advanced bioidentical hormone replacement therapy and mind-body medicine. Our second speaker today is Cecily Eckert, functional nutritionist with expertise in gut health and autoimmunity, which are often addressed inappropriately or not addressed at all, and often lead to much bigger health issues. She will discuss the role testosterone plays in digestive health. We will take questions for 10 minutes after the webinar. However, if you have questions during the presentation, you can type them in the chat and we'll answer them at the end. Okay, let's get started.
Can everybody hear okay?
Yes.
Okay,
Perfect.
good. Thank you. Just wanted to make sure. All right. So, heart disease continues to be the leading cause of death in the United States. This risk increases by 50% after menopause, which is when our hormones are completely depleted. Today, I want to focus on three main things. The first is we want to discuss the signs and symptoms of low testosterone in women. We're going to talk about the risks and the fears that surrounding testosterone for women and why some people think that high levels are dangerous and why they are wrong. And I would like for you to understand the safety, the efficacy, and the many, many benefits of taking testosterone and how this is different from baseline studies and why that is confused by some people. We do prescribe based on 100% scientific literature and evidence. And any hormone can be prescribed for any symptom. This is all supported by a plethora of literature. These are just a couple of things of the many that we have heard from women and testosterone. The names are changed to protect the privacy, but I hadn't had sex with my husband in over 10 years. Now, not only are we having it, we're enjoying it, and it's not painful for me. I also just feel better in my mind, in my body. 67 years old. Then we have Lori, 43. I used to dread mornings. Now I am getting up at 6 a.m. I work out, I feel great, and I can see improvement in my muscles. My energy, appearance, and attitude are all improved. So these are some of the many symptoms. These are most common ones. We don't see a lot of vascular headaches, but fatigue, just loss of energy, trouble sleeping, falling asleep and or staying asleep. Libido is in the toilet, and vaginal dryness. I've heard by many women say it's like the Sahara Desert down there. And anxiety increases, depression increases significantly, irritability, a loss of memory and cognition, decreased ability to orgasm, and incontinence. You just can't hold it in. Gotta go right now. If anybody remembers that commercial from, I don't know, many years ago, getting up at night a lot to pee. And in addition to those symptoms, we also have these signs that are related to low testosterone, which is bone loss or frail bones leading to osteoporosis, wrinkles, testosterone. Well, we'll talk about the benefits, but these are some of the symptoms of low testosterone, heart disease, decrease in muscle mass, and joint deterioration, joint pain. And what is not on here, but I think is very, very important, is also decrease in memory or cognition. I think it was on the last slide. So I kind of think that kind of goes on both of these. And just an overall loss of well-being. It can really leave you with a poor quality of life. You can end up taking a multitude of pharmaceutical drugs with some pretty significant adverse effects, including death. But they don't really tell you about those. Testosterone is not just for men. It's very well known for men. But not only do we lose testosterone as women, we also lose two other hormones, progesterone and estrogen, meaning we have more prevalent symptoms. Yet, although testosterone replacement therapies and medications for men, they're a billion-dollar industry. But women we're just continuously told, you know what, it's just part of getting older and there's nothing we can be done. It is produced in the ovaries and the adrenals. Even though we only produce about 10% of what men produce, we still need it. That 10% is something. We don't need 0%. We need the 10%, which is our 100%, right? It's very essential to health and well-being. And women just get excluded from testosterone and due to some sort of irrational, unfounded fears. And this leaves a lot of women just feeling hopeless, incomplete. There's significant gender bias in the treatment of women, especially perimenopausal and menopausal women. And to use the words of my teacher, who is amazing, Dr. Neil Rouzier, he says that the FDA, the medical community, and supporting medical organizations have turned a dismissive, patronizing blind eye to these women. But why? Why are we so scared? Why are we so scared to take it? And why are providers so afraid to prescribe it? It doesn't make any sense to me, but maybe you've had the thought, well, it's going to make me more masculine. I don't want that. And trust me, you're not going to grow a penis. Testosterone is a male hormone. Well, it is a male hormone, but it's also very, very significant for females. What if I grow a beard or a mustache? You're not going to grow a beard or a mustache. I don't want my voice to be deeper. Or you've been told you just don't need it. Oh, it's just normal. Or maybe they're not even going to test you because they don't know what to do with it. It's just part of getting older. There's really, there's nothing you can do. You just have to live with it. But you know what? Normal is not optimal. And there is definitely something you can do about it. Despite these potentially life-changing symptoms that we talked about, there are 0 FDA-approved products for women, but we can and we do use compounded forms, which are really better absorbed anyways. Unfortunately, the use of compounded hormones are often targeted and attacked without any evidence to back up their claims. There's some sort of political and economical agenda out there. And these so-called experts who write our guidelines or publish them are actually paid by pharmaceutical drug companies to write about their opinions, not evidence, just opinions. I would say this is quite a conflict of interest, but nothing is really being done about that. So today I really hope to convince you that if you even know what guidelines are, especially if you're a healthcare provider, they're pretty worthless. Baseline studies of high levels don't mean anything. The benefits of testosterone are tremendous, and every woman should be on testosterone. The guidelines, for example, the American Academy of the I can't think of what the C stands for. Endocrinology. Their guidelines, they only recommend testosterone in women who have a diagnosis of hypoactive sexual desire disorder. That's it. And we're going to talk a little bit more about that. So let's get into this. Why are high levels dangerous? Baseline studies. Remember that a baseline study, it means that you're not taking anything. It's just you test you and you're not taking any testosterone, you're not taking any hormones. This is just you at baseline. So there's a lot of these baseline studies that show a high level of testosterone and a low level of sex hormone binding globulin, which is SHBG, that's a protein that's made in the liver, are associated with increased risk of heart disease and diabetes. Okay, I just want you to think about that for just a minute and know that association does not mean causation. So, here's, I guess, an analogy is worldwide, national levels of obesity are associated with ownership of refrigerators. Does that mean if you own a refrigerator, you're going to be obese? And what if they say, well, there's also an association with overweight people who have a lot of fruits and vegetables in their refrigerator? Does that mean that fruits and vegetables then cause you to be overweight? It means nothing. It might be a little interesting, but it doesn't mean causation. That's really, really, really important to understand, is that just because there's an association, it does not show causation. And in order to show causation, we have to see what happens when women take testosterone, not what their level is at baseline. So let's go a little bit further into this. The lower the SHBG, the higher the free testosterone. So testosterone will bind onto SHBG, onto that protein, when it's higher. So if it's lower, then you have more free testosterone available. And the higher your SHBG, the lower your free testosterone. So this is really about SHBG. It's not the testosterone, but people do interpret just the testosterone is harmful just based on, oh, but we observed. That doesn't mean anything. It's totally not logical. So here's an example. Somebody with insulin resistance, which is pretty much everybody, at least who comes to see us, but I think it's pretty prevalent among our entire nation, including diabetes, women with PCOS. Insulin, they'll have high insulin. We test insulin as well. It should be 5 or less, ideally. But when your insulin is elevated, that will suppress your SHBG, making your testosterone higher. High testosterone is not harmful. All the studies show that low SHBG is what is harmful, and that's what increases the risk of chronic disease. The higher the SHBG, the better. Low levels of SHBG are considered a biomarker of metabolic abnormalities. So just again, the low SHBG is bad, high SHBG is good. But how do you raise it? Well, since insulin suppresses it, you need to lower the insulin and lower visceral fat. So when you give testosterone and other hormones too, thyroid, estradiol for postmenopausal women, and even progesterone, it helps tremendously. So you give testosterone, which then raises the SHBG, which will lower the free testosterone. So to help somebody feel better, you probably have to give more testosterone. You can't just say, well, it didn't work. It's kind of like giving a baby aspirin for a migraine and saying it didn't work. So when you give more testosterone, you raise the free testosterone, and that then is going to raise the total testosterone. And that's when people panic because they think that it's dangerous when it's not. There's not a single study out there to show that it's dangerous anywhere. The gist and the point of one of the papers that I was studies is to give testosterone to lower SHBG. So in order to see what happens when we give testosterone, it has to be an interventional randomized control trial, not just an opinion paper. And we're going to come back to that. So treat symptoms, not levels. It's really about the symptoms. And here I just want to bring up this. This is a opinion paper, which menopausal women should use testosterone for low sexual desire. That's what I mentioned earlier about the hypoactive sexual desire disorder. This is just a position paper. It's just somebody's opinion on testosterone for women. It was published by an international group of researchers in the Journal of the American Medical Association, that's JAMA, in 2020. And they basically said that they insist that it should only be used for hypoactive sexual desire disorder. So how do we define that? Is it defined? It's not. It's not defined. So then this says nothing about levels. It says you can treat it only for women who have low sexual desire disorder. And it's not based on a number, it's based on a clinical diagnosis. And same thing we use to diagnose things like depression, anxiety, and any mental health disorders. This opinion paper was used just to draw the conclusion that there's no medical need for testosterone use in women. Total absurdity. Total absurdity. So if we say that, hypoactive sexual desire disorder, okay, well, let's compare that to the mental health disorders. What lab tests do we use to diagnose that? Nothing. We don't use anything. If somebody comes in and they have symptoms of any type of mental health disorder, we're quick to prescribe medications. We don't do any testing. We don't even do any type of genetic testing to see how you might process it. And there's, of course, potential risks, including suicide with antidepressants. But that's not talked about and that's not tested. We just hand them out, right? There are no lab tests. These are all clinical diagnoses. And I'm not saying that we should never prescribe antidepressants or any psychotropics, because they do help people significantly sometimes, but not always. And there's no lab test for that. It's just, how are you feeling? So that paper, this one that was an opinion paper, they actually even said that women are at greater risk for cardiovascular disease and breast cancer, and therefore they shouldn't take testosterone, which again doesn't make any sense to me. There was a unanimous agreement by everybody that endorsed this position statement, saying that there's a desperate need for products for women. But of course, due to this sexism and ageism, women's sexual needs are completely dismissed. And so Dr. Angela De La Rosa, she wrote a rebuttal to this paper, and guess what? JAMA did. They rejected it. But it was accepted by a medical journal called Androgens, and basically she just talks about the gender and pharmaceutical bias to the use of testosterone in women. People don't, but this isn't, well known because her paper was rejected at first to that specific opinion paper. So again, baseline studies do not show causation. Opinion papers do not show causation. The association does not mean causation. So what happens when women take testosterone? If high levels are associated with risk at baseline, what happens when you give a woman testosterone? What happens when you take it? There are many studies, and every single one shows benefit to taking testosterone. There's not a single study that shows harm. Here's one example. This was testosterone in women, the clinical significance. It was in the Diabetes Endocrinology, it was published in 2015, but this is quote from this paper is that testosterone is an essential hormone for women. Well, duh. That's what I want to say. And then they also say that in clinical practice, concentrations of testosterone in serum, the blood, are pretty arbitrary. You should always interpret them based on symptoms, improvement in symptoms, and not numbers. We can only hope that the medical community and the pharmaceutical industry will someday do a better job at addressing this unmet need for women. But until then, we are relying on our compounding pharmacies to fill that void. And we continue to fight to protect our abilities to treat women and to do things that make sense, that helps improve your quality of life. And we've even seen reversal of disease. Symptoms, not levels. This is all in the medical literature. This is really what I want to drive home today, is that there's confusion, which I know we all know. We get confused when we read. I mean, you can Google whatever you want to, you can find whatever you want to find. But when you look at what the evidence really says, there's nothing that says that it's harmful. It's all beneficial. Testosterone can provide symptom improvement. That huge list. I mean, the biggest ones we see is definitely libido and just overall drive, motivation for things in life. Mood, it helps significantly with depression. Those are some of the biggest improvements that we see. And of course, vaginal dryness, there's no longer a desert down there. It's now nice and non-deserty. There's not only symptom improvements, but health benefits. The health benefits are significant, especially for heart disease and bone loss and cognition, memory. It improves memory significantly. And just overall, improved quality of life. I mean, in all the studies, it says improved well-being, improved well-being, improved well-being. I mean, who doesn't want that? Why are we not doing things that actually help people? We just want to dismiss that. It's not making any sense to me. So the other things, we talked about earlier were that a low testosterone can lead to bone loss, frail bones. So when you take testosterone, you don't get that. It improves wrinkles. It also improves and reduces your risk of heart disease. If you've already had heart disease, it improves markers with that. There's no need to take 57 different pharmaceutical drugs when we have something that we can give you that your body naturally makes. And the chemical structure is the same as what your body naturally makes. Why would that be harmful? This is what your body naturally makes. Why would hormones be harmful? Any hormones, if they're human identical, bioidentical, and then you take them, it's just the same thing as if you're deficient in B12. We're not worried about that. So why are we worried about taking something our body naturally makes? We're more quick to hand out these synthetic chemicals that don't have a bunch of randomized control trials and don't show benefit. So no more heart disease. You have improved muscle, and your joint pain will decrease, and your deterioration of your joints will stop, and you'll have increased memory and cognition, increased energy and drive, better sleep, increased libido. Sometimes that can be a problem if you're in a relationship and your partner doesn't meet you there with the libido, then we can have an imbalance. But overall, for most people, it's a good thing. You will have decreased anxiety, your mood will be improved, irritability just kind of goes away. Your memory improves, vaginal dryness, we talked about that. Orgasms are now happening, or happening more easily or more often. Headaches are decreased, no more hot flashes. You're not peeing your pants and you're not getting up to pee at night. Who doesn't want that? She looks pretty happy. And the decreased visceral fat. So that is the fat that surrounds your organs. We do oftentimes relate it to our belly fat, but it is, I'm sure you all have all heard of skinny fat. Somebody can be very thin, but they can have increased visceral fat that you can't really see. You have to measure it. We have a body composition analysis scanner here where we measure that visceral fat, because we know that the lower it is, that's how we decrease risk of heart disease, Alzheimer's, dementia, osteoporosis, diabetes, and even breast cancer. Testosterone, I don't have time to get into all of this today, but Rebecca Glasser is an MD, and she's done a lot of studies. She's actually a breast surgeon, and she uses testosterone to treat her breast cancer patients. And she's done a lot of studies and based her symptoms on, or I'm sorry, tested levels and related them to the women's symptoms. And all the symptoms were improved with a level of about 2 to 300, 500 even. And then once they dropped down, actually I think it was 500. But then once the levels dropped down to, especially around 200, symptoms started to, about half of the symptoms started to improve. And then once you went lower than that, all the symptoms returned. So there is no specific level that, well, let me mention this about with men, they have a specific number that was randomly chosen by Medicare. So 300, they say that if you're a male and your testosterone level is 301 and you're fine. So just think about this scale as like a grading scale. So if the level is 300 to 1,000 for men, why are we aiming for a D minus? Why aren't we aiming for an A plus? And for women, even though we have women who maybe their total level is 60 and they feel great, or maybe their total level is 15 and they still feel great, or maybe their level is 150 and they're still having symptoms. They don't feel better until their level is 2 to 300. There's no specific level for every single person. It's really guided by how you feel, and also has to do with sensitivity of the cell receptors. So I got off on a little bit of a rabbit trail, but I just wanted to let you know that testosterone is very, very important in helping to treat and even prevent the recurrence of breast cancer. It's pretty significant. Just remember that baseline observation is completely different than a randomized controlled trial. And we prescribe based on scientific literature and evidence, not biased opinions that are funded by Big Pharma or baseline observations opinion papers. We don't listen to people's opinions unless it's backed up by evidence. Any hormone can be prescribed for any symptom. This is all supported by a plethora of literature. And many, many studies show that the levels really don't even matter, that therapy should not be based on a level initially or to gauge treatment. It's how you're feeling. Imagine that. Let's actually pay attention to how you feel. So many health benefits. Testosterone protects our heart, brain, muscles, bones, enhances cognitive performance. But high levels are harmful. No, they are not. They are not. They are not. Show me the evidence, because it's not there. Baseline does not matter. If somebody's going to show you a study of a baseline observation association study, it does not mean causation. When women take testosterone in every single study, it shows benefit. The benefits are immense. Oh, the C's covered up there, but I think you probably know what that's supposed to be by now. Association does not mean causation. And I will leave you with two more thoughts, and then we'll move on to Cecily. So association does not mean causation. You cannot rely on baseline observation studies, and we really need to treat symptoms and not levels. This is many, many studies that show treatment should be guided by clinical improvement in symptoms, not any specific level in the blood. We do test levels in the blood just to make sure you're moving in the right direction to really to see, okay, well, you feel good. Where's your level now? And to show you that, oftentimes I've seen triglyceride levels drop by 50% within a month or two just by being on testosterone. It's pretty amazing. So when those numbers drop and your testosterone level is 250, who cares? There's nothing harmful about that. You feel good, you are living your best life, and the metabolic markers that are putting you at increased risk are now low. So why are we not doing this? It doesn't make any sense to me. And I just want to touch real quick. There are different forms of testosterone. The one that really provides the best protection and improvement in overall symptoms is, for most women, it is cream. So we provide testosterone, or we prescribe testosterone cream. It comes in a little clicker. Actually, I can show you. It's like this, and you just click it once. Little cream comes out the top, and you take your finger and you apply it to your labia of your vagina once every single night. And it absorbs really, really well there. It works better for both men and women. The cream works better for men and women. It's a more steady state. You can adjust the dosages. Some people really love the pellets, but I'll say one thing about pellets. If you're wanting to reduce your risk of breast cancer or breast cancer recurrence, or even if you can treat it, one of the ways that testosterone improves that is that when you apply the cream, it helps your testosterone convert into something called DHT, where pellets don't really provide that much conversion. So there's no if the pellets work for some. Some women take testosterone injections, and there's also the oral capsule form. We do prefer the cream, just it's easier to adjust those dosages, and it provides the best improvement, especially with vaginal symptoms. And just a little side note, men should not take oral testosterone. But all right, so that was my final slide, and we are going to move on to Cecily.
Hi, good morning. Megan, before I hop in, as I was listening to, I just wanted to see if you could chat just briefly because you were talking about the pellets and the injections and or maybe I just say it, but I'm not a hormone specialist, so I do take testosterone. But what I appreciated about using the cream, and you hit on it a little bit, I just want to kind of drive it home, is that you had mentioned to me, if you start with pellets, if you start with injections, that dose actually might not be optimal for you at that time. So you did say it's harder to adjust. But I just wanted to say, I've had friends who've done pellets. In fact, lots of people talk to me about pellets and, talk about, uh, an increase in libido that is something that's maybe not sustainable, or I don't even know what the right word is, right? Or maybe not comfortable in the beginning. And when you
Right.
dive into the injections or the pellets, you run the risk of having some of those things that might seem a little negative, where if you would have started with a cream and worked your way up to find your optimal dose,
Correct.
then you could maybe move over. Do I have that right?
With pellets, you can't, they're stuck in you for, and if there's any of those symptoms that you don't really like, or if it's not quite, you're not quite feeling where you want to feel, it's 3 months until they usually will check levels and then place in the pellet again. So that's just something that goes, it's a little surgical procedure, goes in your booty, and they just put the pellet in there, and then it just releases the testosterone, and usually that's replaced every 3 months or so. So, and there are plenty of women who love them, but just in my experience, I have seen women who didn't really care for them because of the fact that you can't adjust the dose up and down, and if you do, sometimes your libido will skyrocket, and that can be sometimes uncomfortable for some people. Um, and if you wanted to adjust that dose, then you can easily do that with the cream.
Okay, perfect. Thank you. As I was listening, I thought I would throw that out there for clarification.
Yeah.
Okay. So as I'm not a hormone expert, but there is definitely a correlation between what happens in the digestive tract and hormones, testosterone being one of them. So I just wanted to pop in and highlight a few things that I think are significant enough to talk about today in regards to the two, the testosterone and digestive system. And I'll just start by saying that, overall, testosterone have been shown to reduce inflammation in the digestive tract. And I'm going to kind of talk about that in just a second, because that's kind of a broad statement, right? But in addition to thyroid, testosterone also helps improve motility. So motility is that wave-like motion that takes everything that we put into the digestive tract via, what we eat, and move it through the digestive tract and send it out for elimination. Testosterone plays a role. So, um, in the last 8 to 10 years, I've realized that, talking about digestive issues and poop and all the things is that women really do trend towards constipation way more than men do. And, like Megan's been talking about, what's the saying? It's association is not causation, but it's hard to ignore that so many women do deal with constipation. And our testosterone levels are definitely, lower than men's. Is does that contribute? Absolutely. But also thyroid does too, and lots of other things. But so there's been studies that have shown that testosterone actually helps to reduce pain in the digestive tract. And I'm kind of skipping around, but this last bullet on the right, where testosterone plays a role in serotonin reuptake in the brain. Um, so the gut is kind of home to some of these feel-good hormones, right? And so there's a play between the digestive system, these feel-good hormones, these pain modulating hormones that we naturally produce, and testosterone. So without kind of going into all of the pathways and significant underlying mechanisms, to keep it kind of simple, we do know that for lots of different reasons, testosterone is playing an active role in pain management in the digestive system. And then leaky gut also has this association with testosterone as well. And there's studies that have been shown um, to help us better understand lower or optimal levels of testosterone can actually help prevent leaky gut. And leaky gut, just to pause for a second, also known as intestinal permeability, is when they're located the tight junctions in the small intestines, which is where all of our absorption happens, is through these tight junctions. We want them to be nice and tight so that um, it only allows for the absolute most broken down extracted nutrients to be able to move from the small intestines into blood circulation. Leaky gut is when those tight junctions kind of start to fail and separate and allow for the passage of larger molecules to move into the to blood circulation, which means then we can become inundated with systemic issues just from having these tight bonds become more weak. And so optimal levels of testosterone actually help prevent the breakdown of those tight junctions. And I'm going to be honest with you, there's something in my mind that leads me down a track. Maybe Megan can speak to this as, a side note, but I almost feel like, if testosterone plays a role in uh, in muscle development and in protein structure, right? Protein structure is kind of the base level of the development of muscle, that those protein structures in the small intestines forming the tight junctions might become weak when testosterone is low. Do I have that right, Megan? That protein, that you're on mute.
Sorry. Yeah, I was just saying that makes sense to me.
Yeah, okay. I just wanted to make sure. I mean, I've seen the muscle development that comes from testosterone, and that's really just building up the protein structures, right? And inside the digestive tract, there's plenty of protein structures. Those tight junctions are absolutely one of them, and so I can see how low testosterone could be a contributing factor to leaky gut. Um, so the next bullet there is low testosterone patients may have an increased abundance of opportunistic pathogens. So when this first bullet where we talked about, testosterone reduces inflammation in the digestive tract, I think that the last kind of three bullets I want to talk about in combination with one another, because it's really all talking about imbalances in that super diverse microbiome environment. Um, and testosterone is playing a role in all of that, this enormous microbial environment in the large intestines. There's also other microorganisms that are found in other parts of the digestive tract too that could be impacted here. So I think that there's a symbiotic relationship between all of those species and testosterone. And then we kind of throw in this other piece of it where testosterone plays a role in serotonin reuptake in the brain, which can improve activity and mood. So, just motivation and things like that. 95% of our serotonin is actually produced in the digestive tract. And so the the microbiome, all those bacteria they are impacting and having um, signals that are sent out where is serotonin production is happening. They're signaling the release of serotonin. Testosterone is playing a role there. So I think that while testosterone can help reduce inflammation in the digestive tract, I think that it can also be that if our digestive health, if that microbiome isn't flourishing, isn't balanced, that it could actually also have a negative effect on testosterone production as well. So I kind of think it's um, a, as I said, like symbiotic relationship. But I think they can both have an impact on each other. And so obviously, you want to be testing to see what your testosterone levels actually look like. Make sure you're testing all the numbers that matter or markers that matter. But you also want to be looking at the microbiome and how effective and efficient your digestive system is, because they each support one another. Um, and that when things are out of balance in the body, we do see an increase in opportunistic organisms that will overgrow. By nature, they're more aggressive, that can have this negative impact on inflammation in the digestive system that can cause a cascade of dysfunction. And so I think that I don't necessarily want to say that they're all caused by low testosterone. But if testing shows and how you feel indicates that your testosterone levels are not optimal, then bringing that in and correcting the dysfunction, the low testosterone levels, or correcting the way that you feel, can have a positive impact on digestive health and the other way around as well. Digestive health, kind of going in and balancing things out, can also have a positive outcome on testosterone levels and mood and all the things. And I think just from a personal perspective, what I would like to say is that I have absolutely seen kind of all the benefits that Megan has talked about in bringing in testosterone. But the one that stands out the most, two that stand out the most, is I spent most of my life being physically active. Body movement was really important. Never felt like my muscle development, how I was physically seeing myself, was translating to the amount of energy that I was putting into my workouts every day. And while I had other benefits, just like mental health benefits from body movement, I wasn't really seeing my body change as much as all the energy I put out. And I've definitely seen improvements since starting testosterone. But the mood piece of it, I think, is significantly improved. Um, and I think that that overall, it's yes, I have increased my testosterone levels, and it's having this positive impact on my digestive health as well. And so um, I that's honestly all I have to bring to the table as a non-hormone specialist. But um, I definitely think that, is there anything that you want to add, Megan, before we open it up to questions? You're on mute. You're on mute.
Sorry, thanks. So three things. One thing is that I hope, Cecily, you don't mind me sharing this with everybody, but I remember Cecily saying, "Oh my gosh, my like ability to just handle stress is so much better now." And that's what we see a lot too, is sometimes people don't even realize how bad they're feeling until they start feeling better. I do want to just touch real quick. Some women do experience side effects of acne or facial hair growth. Usually it doesn't happen unless that's already been a problem. Oftentimes it's really due to insulin resistance, so getting that under control. And the benefits of testosterone are so immense. Uh, I don't have anybody who decided to stop it. There's something that we can do to help significantly improve those two things while taking testosterone at the same time. And as far as levels go, if you do, we test all baseline levels, and oftentimes, especially postmenopausal women, the level is zero. So of course, I think at that point the level matters because that means you don't have any, right? And so if you don't have any, or if you have just a teeny tiny bit, it's really important to get some on board and to retest and make sure that you are absorbing it and that that number is moving on the result. I think those were the three things. And then just wanted to say thank you all for being here so much. We really want to do these webinars just to help people understand the benefits of improving your digestive system, improving your hormonal health, and just to help people understand that. And that's the goal for all of these webinars, is to help educate and support you all, help you learn how to advocate for yourself, what questions to ask, things like that. Uh, are there any questions? What questions do you have?
I have one or two maybe.
Okay.
Hey, so I guess one of the biggest things, and this may seem kind of like obvious, but I'm just kind of like, this is also interesting to me for one thing. So thank you all so much for sharing. But I'm so curious on how testosterone levels can't be too high like that. So I guess like this, and that's what I said. This may seem like I guess not a dumb question, but but say okay, like say if somebody's going through gender affirming care, right, and
Right.
they're wanting to they're biological female, wanting to transition to male. What
Right.
is the difference? So what are they doing to
Yeah.
turn in to like really get all the What's the difference, right?
Well, the dosage is different. The
Okay.
dose is significantly different. So the dosage that I would say most women, we start them out at either let's see, 2.5 or 5 milligrams a day.
Okay.
For men, I start them out at 100 to 200 milligrams a day.
Okay.
So there's a significant difference in
Okay.
the dosage, right? So you don't want to give a woman a man's dose because we only need about 10% of what a man needs,
Okay.
you know. But when you give a woman the dose that's, that makes sense for women, if you're I have patients whose levels are over 500 and they feel great. I mean, mine is almost 300, and I'm like, okay. And I really noticed a difference when it was for me. Um, well, at one point it was 20, and I felt horrible. But yeah. So that was a really good question, Lindsay. Thank you for asking that. What other
Yeah.
questions are
Thank you. Yeah. I guess that was kind of really just. I was like, well, wait. So if it, I
there?
was just
Yeah,
wondering. I was just wondering, what do people do? I guess they just get a huge high dose, right, to go from
yeah,
male to
yeah,
or
for
female
sure.
to male.
Yeah,
Okay.
and this is something very interesting that has nothing to do with women, but one of the ways that testosterone benefits men is by converting into estradiol.
Oh,
That's a whole nother webinar, but but it's really interesting that men need estrogen just like women need it. It's really that's what kills prostate cancer cells.
wow.
But
It's so crazy that this isn't talked about more. Yeah. Thank y'all so much.
oh, you're so welcome. Thank you so much for asking.
Yeah.
Who else has any questions? I think our next webinar is going to be on autoimmunity and immune system dysregulation. We will put that out, send it out in email. It'll always be on our website. If you go to the website and scroll down just a little bit, our webinars are there. We have them every month, the last Thursday of every month at 11:30. If you can't make it, we do record them. They'll be on our website. And I'm going to stop the recording right now.